maintenant, c'est parti.
Merci. Bon après-midi tout le monde. Mon nom est bienvenue à cette conférence d'ouverture de la session d'hiver des activités scientifiques du CReSP, du Centre de recherche en santé publique. Mon nom est Louise Potvin, je suis professeure titulaire à l'École de santé publique et directrice scientifique du CReSP. Je me réserve le droit à quelques reprises durant l'année d'avoir des invités, de faire un événement spécial. Et aujourd'hui, c'en est un. Donc, nous aurons une invitée d'Angleterre, Dr. Jennie Popay, qui sera suivie, dont la conférence sera suivie par deux personnes locales pour discuter de l'ensemble de ces idées. Aujourd'hui, on essaie quelque chose de nouveau. On a la possibilité de vous offrir l'interprétation simultanée. Voici comment vous pouvez y accéder. Vous pouvez prendre cette conférence entièrement en français ou entièrement en anglais. Et si vous n'activez pas l'interprétation, ben, vous aurez les intervenants qui parlent en français, vous les entendrez en français, et l'intervenante, professeure Popay, qui parle en anglais, vous l'entendrez en anglais. Ceci est notre première conférence de la saison. Nous en aurons plusieurs autres qui sont déjà cédulées. Je vous invite à visiter notre site web CReSP.ca pour avoir la liste complète, pour pouvoir vous y inscrire. Ces conférences, les 4 qui sont présentées là, auront lieu le midi. Et je vous invite aussi à suivre notre calendrier sur notre site, puisque ce calendrier-ci ne va qu'à la fin mars et nous avons déjà une planification qui est en cours pour les mois d'avril et mai. Il me fait donc très plaisir aujourd'hui de vous présenter professeure Jennie Popay. Professeure Popay est professeure distinguée de sociologie et de santé publique à l'Université Lancaster en United Kingdom. Ceux qui connaissent un peu la santé publique, la recherche, la connaissent pour ses travaux sur l'équité, l'exclusion et la santé. Et sur le plan méthodologique, elle a fait un travail remarquable, entre autres avec le groupe Cochrane, pour la production des guides et des directives pour la conduite et la publication de synthèses d'études qualitatives. C'est un immense plaisir d'accueillir aujourd'hui professeur Popay. Sa conférence, qui est intitulée « Challenging the Community Gaze in Public Health, Power, Assets and Health Equity », sera suivie et discutée par 3 intervenants locaux que nous avons invités pour cette rencontre. Le premier, M. Yves Bellavance, est coordonnateur de la coalition montréalaise des tables de quartier. Ceux qui sont bien au courant et actifs sur les réseaux sociaux et en lien avec le développement communautaire savent qu'il est lui-même très actif et il contribue publiquement depuis plusieurs années aux réflexions sur les grands enjeux montréalais, toujours dans l'objectif d'en faire une ville plus juste et plus inclusive. Personnellement, je tiens aussi à souligner qu'il est un partenaire de la première heure de la chaire Approche communautaire et inégalité de santé, avec lequel nous avons réalisé de nombreux projets. Le deuxième panéliste est M. Mario Régis, qui est vice-président au développement social à Centraide du Grand Montréal et qui est évidemment tout aussi connu dans le monde communautaire montréalais. Auparavant, il a travaillé à la direction générale du regroupement des centres de la petite enfance de l'île de Montréal, du centre 1, 2, 3 Go et d'avenir d'enfants. C'est quelqu'un qui a une longue pratique de l'activité communautaire, de développement social et maintenant à Centraide, il a le plaisir de distribuer des ressources pour ce faire. Notre troisième panéliste doit s'excuser. Il y a 1h30, nous avons reçu un courriel disant qu'elle devait accompagner sa mère aux urgences. Donc, c'était... nous devions recevoir Madame André-Anne Parent, qui est chercheuse au CReSP et professeure agrégée à la Faculté des arts et sciences de l'Université de Montréal. André-Anne s'intéresse aux inégalités sociales, à la lutte à la pauvreté, au développement des communautés, à l'action collective et aux pratiques professionnelles de proximité. Elle nous a fait parvenir son intervention. Je vais la résumer pour elle et nous pourrons ensuite interagir avec Professeur Popay. Donc, Jennie va parler pendant environ 35-40 minutes. Et ensuite, je donnerai la parole à Yves, Mario. Je résumerai brièvement l'intervention d'André-Anne. Jennie pourra répondre à tout ce monde-là et ensuite nous engagerons une conversation avec le panel et vous pouvez, bien sûr, en tout temps, utiliser le chat pour nous faire connaître vos commentaires. Un dernier mot, il y a sur le chat un lien pour obtenir vos réactions sur l'interprétation. On aimerait, comme c'est une première pour nous, on aimerait vraiment savoir dans quelle mesure vous l'utilisez, si c'est utile et si on doit continuer dans cette perspective. Jennie, all is yours.
Thank you. Thank you very much. And so first, just to say thank you to Louise for inviting me. It's very nice to join you in Canada from the north of England, where we are having a Canadian-type snowstorm. At least it feels like that. It probably is nothing like the levels of snow that you get. So before I start, just let me see if I can share my screen. But before I start, I just wanted to make a few positioning statements. The first one is that, as you can tell, I'm an English-speaking white European woman from a relatively privileged background. So these characteristics inevitably shape my perspective on the issues that I'm going to be talking about. But in particular, I'm conscious that I'm speaking in English to an audience for whom French is probably the first language of most of you. So I apologize for my lack of linguistic skills. I'm just now in my later life stage learning Spanish. I couldn't do more than one language and I'm struggling with that, so apologies. Second, just to say that my research is about health inequalities, and I should just give you my kind of ideological position. It's also based on evidence, but my position is that these inequalities are caused by the distribution of power and resources in our societies, and that those in turn produce the conditions in which people are born, they grow, they live, they work, and they die. And these upstream structural determinants are amenable to action. They're not inevitable. They're a political choice. And that's not just the government's political choice. In those countries where citizens can vote for their governments, it's a majority citizen vote choice as well. So these are issues for me of social justice. It's a social justice agenda, the health inequalities agenda. The third point is that I use health promotion and public health interchangeably. In the UK and some European countries, we don't use health promotion very much. We talk about public health. But essentially, what I'm referring to is the policy and practice that is looking at population level health, population level conditions. And I'm focusing on work with communities. I'm not going to get into defining this very problematic word, community. I'm just making an assumption, simplistic. Most of this work is about communities of place in neighborhoods, the people who live in neighborhoods. And it's mostly, the comments I'm making are about disadvantaged communities, communities that are living on very low levels of resources, communities that are stigmatized, that are exposed to other kinds of structural injury and violence, racism, sexism, etc. So I think those are quite important to position what I'm going to talk about. So let me now share my screen, if this works. Okay, I presume that's okay. So my first slide is in French, and I'm not going to try and pronounce it, but I thought I should at least make a gesture. But the presentation is in 3 parts. The first part, I want to use this metaphor, the power of the gaze, which I'm taking from Foucault, to critique the way in which public health promotion understand community in a lot of the policy and practice. And secondly, then, in the context of that discussion, I want to briefly present some findings from an evaluation we're doing of a very large-scale community empowerment project in England called Big Local. And then thirdly, I want to suggest some ways in which health promotion, public health work might become more equity sensitive, more social justice sensitive. It appears that my cursor. So first Foucault, this notion of the power of the gaze. Actually, it was Sartre, I think, that first used this notion, but this is a very complicated landscape from philosophy through to history with this notion of the gaze, including cinema, film studies, film theory, for example. So some of you in the audience might know more about this than I do. I think it was Pope, the poet, who said, "Fools rush in where angels fear to tread." Well, that might become apparent, but I've been primarily looking at Foucault. But what Sartre was arguing was that our understanding about ourselves, our sense of ourselves, is constructed through the interaction of others. And depending on how much power and social status those others have, we are more likely to internalize their sense of us. And the classic example of that is the doctor-patient relationship, where the doctor is the one with the gaze and the patient is the one who is being gazed at, who is being observed. And it's the doctor who has most of the power. Now, what Foucault did was, I think, be a bit more explicit about the working of power in these social relationships, these social processes. And he also moved between individual interactions, interactions between individuals, to the societal level. He was still interested, as this quote here says, about individuals, but the gaze is a gaze at a social level. It may operate through individuals who have an inspectorial function, like the police or judges, but actually that gaze is a gaze that is being shaped by dominant social discourses. So, as he says here, there is no need for arms, physical violence, material constraints to get people to behave in the way society wishes them to behave. An inspecting gaze, a gaze that each individual under its weight internalizes, each individual thus exercising surveillance over and against themselves. So it's that process again, whereby the gaze, the power of the gaze, is what shapes the way in which we see ourselves. But that for Foucault, that was a societal-wide process rather than an individual interaction process. And interestingly, Foucault also presents quite a different understanding of power than is common in the literature. He talked about constitutive power, which comes from everywhere, operating through social discourses and systems of knowledge. And he argues that power produces social reality by giving meanings to social identities and also by determining what action is possible or appropriate for those. So the classic example there would be, well, not classic example, but an interesting example is poor mothers, low-income women with children, right? They are subject to the power of the gaze by many, many professions, right? And they internalize that without a doubt. The research suggests that they feel very deeply stigmatized by their interactions. They feel of less worth by the power of that gaze. But it's also the case, looking at Foucault's quote there at the moment, whilst low-income women are power's intended target in that sense, in that they are devalued by the gaze, they are also the effect of the gaze. So, for example, good mothering, what it constitutes, what in different cultural settings is socially determined through discourse, right? So it's not only that poor women are immediately exposed to this gaze, this power gaze, but what they perceive themselves to be inadequate at is also constructed through what Foucault calls constitutive power. And what they feel it's possible for them to do is constructed in that way. Now, most of the work on the power of the gaze in social science, anyway, has been undertaken in medicine. But without a doubt, what we know is that people in societies, in high-income societies in particular, and particularly poor people, are now subject to enormous amounts of surveillance. Their behaviour is under inspection all the time by researchers, policymakers, practitioners. There are so many researchers now studying exercise, diet, those smoking, whatever those behaviours are. So there is this general sense of surveillance about health behaviour. And of course, we in turn, as experts, as a researcher, as a public health person, as a practitioner, as a policymaker, as a funder, we're all being gazed at by people who are more powerful than us. So I'm not in the business of blaming anybody here. It's a very complex set of social processes, but it's a powerful one. So what I want to argue is that in the same way as poverty is constructed through these processes, and the lives of the poor and their sense of their identity as poor people, so too is the notion of community, really. And this slide is just showing you some of the ways in which community has got under our skin, really. Generally, the power of the gaze in terms of community is that it's a warm, cozy, positive, mutually helpful entity, really. And if you go online, as I did, those are the kind of images that you get. If you just type in images of community, they're lots like the one at the bottom here, lots of hands around the world, global communities, local communities, creative communities, communities doing a lot together. You might be amused to know that Canada has its own wiki project on communities, which is up there on the left-hand side, which I was fascinated by. But apparently one of your magazines also runs an annual best community competition. Now, I haven't come across that in the UK. So this generally, the power of the gaze on community is hiding the very difficult aspects of communities. We're not talking only here about disadvantaged communities, but all communities are riven by divisions and fractures, and people have multiple community hats on. They don't just sit in one community. And of course, one of the global characteristics of community is that it's deeply gendered, that most community labour is women's labour. And you don't see that generally you don't hear it, and you don't see it in the imaging of community. And in our pandemic world, certainly in Europe, and I know in many other countries that I'm aware of, the power of this gaze on communities is immeasurably greater, much, much greater, as community groups and members of communities have been filling the gaps left in public provision. So in the UK, they've been delivering food, they've been making sure people, social connectedness, they've been out on the streets, providing music to ensure that people are making some kind of connections with one another. They're providing extra teaching resources for kids because some of the schools aren't coping. An enormous wealth of things that lay people are doing, which has been defined as community. Community is doing this. So here's a blog from Public Health England, which is our national public health agency, which says resilient, connected communities have been springing into life to support people in need. And then they say, community life is essential for health and well-being. It's a kind of nugget of the way in which the power of the gaze has constructed community for us. But of course, disadvantaged communities in their diversity are constructed by the power of the gaze in different ways. But from a community public health promotion perspective, that gaze has shifted dramatically over the last few decades. And that's what I want to really focus on in the next few minutes. And in Europe, it can be kind of dated, this quite dramatic shift in the power of the gaze on disadvantaged communities. I use that as a catch-all term. Can be dated to the publication of this book by McKnight and Cressman, which I'm sure is familiar to you. It was based on 2 or 3 decades of work that they'd been doing there at Northwestern University in the US. And it's triggered this global movement, tectonic shifts really in the way in which disadvantaged communities are seen, from what was criticized at the time as a deficit model of communities, a view that they lacked everything, and that community development was about going in and building everything back again, to the ABC approach, the asset-based community development approach, where basically communities are seen to have rich assets. Disadvantaged communities are seen to have rich assets. And at the core of this approach is the idea that these assets reside in the people who live in these places, but they're also sometimes, not always, seen to be provided by local agencies. So they might be the parks, the community hub, the library. And combining those assets means that communities can be more independent of the public sector in particular out of America, not surprising given that the public sector is pretty weak in the US. But as I shall show you in a moment, this is quite evident in the UK, that this strength-based approach to community initiatives, community empowerment, is being seen as a way of reducing dependence on publicly funded and provided services. So obviously, I would not deny that the strengths-based approach has benefits, and not the least of which is this: it is less stigmatizing, and it does recognize that that people who are bearing the brunt of our unequal societies are have skills, have competencies, have strengths. I personally don't like the word assets, but I think that's really important to recognize that all of this is in the context in many countries where the local and national state, this is pre-COVID, and public provision of services by the state has been shrinking. And these are, in that context, I think, these approaches are revealing themselves in Europe and the UK, I do not know about Canada, as do-it-yourself welfare, DIY welfare. And the little yellow caption here captures this kind of notion of caution, empowerment zone ahead. So there are now quite a few groups in Europe who are actually very cautious about community empowerment initiatives, exactly because they see it as a way of giving them more responsibility for things that have previously been done by the state. And there's There's a lovely cartoon on a lamppost, which I don't think I have in this presentation, which is somebody saying, stop calling me resilient. Every time you call me resilient, you want me to do something. So I think there is that sense of caution amongst increasing numbers of people. But these are the voices of senior professionals in the UK who are expressing their aspirations for what is now in the UK increasingly called community-centred public health. And you can see here that these initiatives are seen by some powerful people, some of the people with the gaze, to be about building resilient, confident, connected communities, to celebrate, support, develop volunteering, which is seen to be the bedrock of community action, to develop self-efficacy, self-esteem, health literacy, confidence to change, problem-solving skills, positive health behaviours, and self-care, to identify health issues and devise and implement the solutions, to emphasise community organising, capacity building, and mutual aid, and to develop social networks and independent community-led activities, and finally, to enable sustainable social action, tackling the root causes of health and ill health. Now, that's only even remotely possible if you understand those root causes to be behaviour. If you understand those root causes to be the distribution of power and resources in society, then that last comment is extraordinary, really. But the problem for me is that these asset-based, strength-based initiatives have shifted the focus, if it was ever not, inward. The gaze, it's now an inward gaze on the capabilities of communities to support and develop volunteering, to be health literate, to identify and implement solutions to issues, to mutually aid one another. So the focus, the gaze, the power of the gaze is now almost entirely internally focused in thousands and thousands and thousands of local health initiatives across Europe. And this may not be the case, as I say, in Canada. And the other part of that is that it's lifestyle and behavioral oriented. So I did a quick review of the images in our dominant policy documents, local, regional, and national. And the most common, as you might guess, is the bicycle. The bicycle is everywhere. And my favorite image, which I haven't got here, is a bicycle with one wheel at the front is an apple. The wheel at the back, I think it's a heart, which is about exercise. And somewhere on the bike, there's a carrot as well. So I think, I'm not saying all of these ABCD, asset-based community development initiatives, are like this, but I would say the majority in Europe and the UK absolutely are. And the problem with that is that what I would call the outward gaze has been marginalized and in many cases has disappeared. Now, this outward gaze is central to the foundational statements about health promotion and public health. So, for example, in the Ottawa Charter, that actually what community initiatives in health promotion were about was supporting communities to organize for social transformation and political change. And clearly, to do that, you have to think about ways in which you can build internal capabilities. I'm not saying that's irrelevant, but it's what those internal capabilities are being directed at. And in my experience, without a shadow of a doubt in England, and I think across Europe, and certainly in America from what I've seen, and in Latin America from some of the Brazilian, this inward gaze is now very dominant. So what's the big local got to do with all of that? So let me just, I've not spoken to myself like this for this length of time for 9 months as I've been locked down here. This is a very interesting initiative. It's the largest community empowerment experiment, we call it, in England ever. And it's funded by our national lottery. And it's 150 relatively disadvantaged neighbourhoods. It's only in England, it's not in Scotland or Wales. And it's managed by a not-for-profit organisation called Local Trust. And these big local communities and the residents receive £1 million each. So it's £1 million to each of those 150. And they can use that money to make a positive difference in their communities over a 10-year period. There are very little rules. Local trusts have been very flexible about what the money can be spent for, how the money can be spent. In practice, they could spend it all at once. Don't think any of them have actually done that, but they can do that. Some of them have spent very large amounts on, for example, building community hubs, putting up buildings for the community, and others have tended to spend smaller amounts. So there's considerable flexibility around the money. The key point is that it has to be collective decision-making. They have to establish a resident-led partnership to oversee the program. They have to develop and review the local plan for the spend with the involvement of much wider group of residents and do that over time, implementing, reviewing, going back to the residents, etc. So it's a very strongly community-led and controlled initiative. There is absolutely elements of a strength-based approach in here. They get a lot of extra help from Local Trust, a lot of capability building inputs from Local Trust. The key difference for me with this is that they also get £1 million. So the assets are extensively increased by that £1 million that they have. So the evaluation is called the Communities in Control Study. Louise, I think, is aware of this because it's been going on a while. The research questions for this evaluation are, does increasing the collective control disadvantage communities have over decisions and actions affecting their lives positively impact on health and on the social determinants of health? And if it does, through what pathways do these impacts come about? It's a 3-phase longitudinal evaluation from 2014 to this summer, and we're just going for funding for a 4th phase. And there are 5 main components. So we've got qualitative fieldwork that's been going on since 2014 in 10% of these areas, and it's a diversity sample. We've got detailed studies of 6 of the actions that big local residents have taken to improve. Quite big actions, like building a community hub, for example, is one of them, to look at the pathways issues. We've got a survey, a repeated longitudinal survey and cross-sectional of the impact on health and a sense of control amongst the activists, the most active residents. We're doing some secondary analysis of population survey data, looking at whether there's any impact at the neighbourhood population level. And we're doing some work on economics, which, of course, is very challenging. Just look at I'm doing on time. It's a collaboration, and these are, so currently it's Lancaster. I'm the coordinator of it, the Liverpool, Newcastle, Durham, London School of Hygiene. Local residents are involved throughout. We've done some co-research with them. They've helped us design some of the field work. They're helping us produce some of the outputs. And in the earlier phase, the universities of Exeter and Sheffield were involved. And it's funded, first 2 phases were funded by the National Institute for Health Research School of Public Health, which we're all members of. And then in the 3rd phase, we got funding from another NIHR program. So I clearly can't go through all the findings. So I decided that I would just focus on these 5 areas, really. It's mostly reporting on some of the qualitative analysis, and it's mostly reporting from earlier on, because we're just doing the analysis now of the longitudinal data. So I want to talk about the fact that what we've found is that to exercise collective control, communities need different kinds of power, and we call those emancipatory power. but that other forms of what we call limiting power can constrain both the development of those emancipatory forms of power and the exercise of them in communities. That these power dynamics, the interaction between emancipatory power and limiting power, operate in what we refer to as participatory spaces. And those power dynamics are different in different kinds of spaces. The £1 million is really important. Clearly, these communities have been able to do things with the £1 million that they would not have been able to do. But the symbolic importance of that money is really important. And it may be that it didn't need to be $1 million to deliver those symbolic benefits. And I'll talk about that a bit more. And then I just wanted to say a little bit about the struggle we're having looking at the impacts on individual health. So I'm going to kind of, and the graphics here, I have to say, are very amateurish. I've been drawing them, and the graphic designer who was going to help me do them has not got them in time. But anyway, it wasn't for this; it was for another reason. So so these are the three forms of emancipatory power, and some of you familiar with the feminist literature will appreciate that this is taken from feminist literature. These three forms of power were developed in that literature, in that research, at the individual level. They seem to operate at the individual level. And what we've done is conceptualize them as collective capabilities for control. And we've also developed markers so that over time we can see if these forms of power change, and they do, but they don't. It's not a linear process, not surprisingly, and they're interactive. They don't. They're not linear in the sense that you need one before the other. They interact, and one form of power can actually undermine or enhance the other. But what's very clear is that communities do need power within before they can do anything else. They need to be confident that they can act collectively. They need to have different kinds of knowledge. They need, crucially, to have a shared sense of identity and interest. They need to believe that by acting together, they will have collective impact on their lives. Power with is the additional power that comes with acting with others. And those others might be other communities. They might be with the local government, with the local health agencies, with the local third sector agencies. But that notion of power with is quite important in the big global context. And then the power to is the actual action, is delivering change, is the ability collectively for these communities to change something for the better. And that's also facilitated by them setting up structures and processes that allow them to do that. The limiting power is based on, there's a very complex literature on power. And again, some of you may be familiar with it. We've drawn on several frameworks here to come up with these four. Some of them will be more familiar than others to you, but so compulsory power, they're all forms of power over, right? They can all be exercised over another group. And indeed, communities can exercise some of this form of power over other groups in their community. And we saw some of that in the big local area. So you have compulsory power, which is direct, visible. It's force. That can be the police, the way that violence against Black men, Black Americans in the US. But it can also be economic. So, for example, in the UK, the punitive eligibility criteria for welfare benefits has been shown recently by colleagues of mine to have been very directly related to an increase in suicides. So that's a form of compulsory power. It's not just force. Institutional power is really important. Again, it's less direct, but it can still be visible, and it operates through institutional rules, agenda setting. Very simple example of that, but nevertheless quite impactful, might be a local a local government that sets up in their regular council meetings a time on the agenda for the community to bring issues, a plus. But actually, this did happen. If you wanted, as a resident of that area, to raise an issue, you had to put it in advance. There was a number of days that you had to get it in advance. And if you didn't do that, you couldn't speak to it. So very strictly controlling what could happen, who could do what. The third form of power, structural power, is indirect and invisible in the main. Its impact isn't, but it's the structures of social class, of gender, of colonialism, of racism, all those social structures that determine the distribution of power and resources in all our societies. And then the fourth form is the Foucauldian power, productive power, that which produces through discourse our social identities, really. And one of the most, to me, one of the most powerful examples of that is the dominant discourse about poverty as an individual failure. That seems, in the UK at least, to have survived for 200 years, that the poor are poor through their own fault, and therefore welfare systems are dangerous because they encourage people to continue to be dependent. That's enormously powerful discourse around poverty. So, as the title of this slide says, that's the little, it's a doctor on the top of that pillar, in case you noticed it. So you've got the interaction between these different forms of power going on in different kinds of spaces. And the third area of analysis of the qualitative data from the big local evaluation was the nature of these spaces and the way that the power dynamics operated within them, and the connectivity between different kinds of spaces. So just to say what I mean by participative space, right? That this is I'm going to pronounce it's French. I've got a French audience here, but you can read it. This really wonderful quote about the nature of space. We're not talking about places here. We're talking about space as a social product. It's not simply there as a neutral container waiting to be filled, but it's a dynamic, humanly constructed means of control and hence of power. And we could see that happening more in some of these participatory spaces than others. But the magic three, we were laughing in the research team recently about the fact that we seem to be coming up mostly with threes. But we basically at the moment, and we may change this as we're doing the longitudinal analysis now, but we identified 3 different forms of participatory spaces. And because these are spaces, it means that a particular location, for example, the big local partnership that oversees the program, when they meet, they can at times be a governance space when they're making decisions, but they're not always a governance space. Sometimes they fall into this second category of sense-making spaces. So governance spaces are where the decisions get made. And in the big local, that is mostly in the partnership space. But they also, the big local partnership, set up neighborhood forums, youth forums. They have project planning groups which are delivering on some of the plans that they're funding, and networks. So it's not only the partnership. And of course, there are external spaces which are governance spaces, like the health agency having its board meetings and things. So in those governance spaces is where these communities exercised power to act. That's where they made the decision. That's where they decided on the action. But in the doing of that, they also developed their power within. They also became more confident. But if they acted on something and didn't achieve it, there was a risk that power within was actually damaged. And we saw that happening. So as I said, this is not a linear path of more and more power. Actually, it's a dynamic process that's going on. And these governance spaces sometimes were residents with professionals. And what we could see in those spaces was the way in which the professional, the local politician, or somebody from the local third sector organization was actually exercising limiting power in different ways. Not always, but you could absolutely see that happening and undermining the confidence of the community members. The sense-making spaces were absolutely critical here, and I think that for anybody moving into working with communities, if they're not already aware of the need for these kinds of spaces, it's possibly one of the most useful outcomes from the analysis we've done, because these spaces, which were informal, they could happen anyway. They could happen in the middle of an event that Big Local had put on, a fair, or, whatever. They had a dog show, which was a sense-making space. There were cafes where residents met one another by accident almost. But what was going on in these sense-making spaces that we observed was that knowledge was shared, new relationships were built, and solidarity was created. And in that process, people began to craft shared interests, a shared sense of what was going on in the neighborhood. And Big Local was certainly stimulating it, because many of those conversations were about this new thing, this Big Local that had this money, who's got control of the money. So there was something that needed to trigger some of those conversations, but the sense making was really important. And then there were the external spaces. So the governance spaces and the sense making spaces were owned and created by the residents. It didn't mean that external agents could not operate in them and use limiting power, but there was more control by residents. The external spaces were by invitation only. And they were very clearly spaces where the communities could be subject to power over, but they could also resist power. They could resist that power, and we have some examples of them clearly doing that. So the money, the money. When we tried to get the funding for this study in the first place, people said to us, "Well, it's only £1 million over 10 years. That's only 100,000 on average every year. That's nothing." Actually, to these communities, it was an enormous amount of money. And this is just some of the things that in the first 3 or 4 years they were doing. So they were using the money to claim back land and buildings that the community had lost, that some private developer had owned, or that was actually becoming derelict. They were training people. They were building relationships with local businesses to increase employment. So they might put some money in to bring a local business in. They'd put some money in, they'd invest in that business, providing they employed local people. They were developing community finance initiatives, cooperative banks, which many low-income communities can't do because they don't have the money to start. Well, this allowed them to do that and was reducing debt and reducing economic insecurity. They were challenging housing plans for local council, challenging transport plans, and they were taking control of local services, so libraries, for example, swimming pools, I think. So they were doing really significant things with the money, and that was important. But as I say, the symbolic importance of the money shouldn't be underestimated, because what it suggests is that that agencies can do some of this without needing to find £1 million per community. And indeed, in Sydney, after I'd been talking about this work, one of the health agencies there has set up a little local, not a big local, with less money, but they have given the community money to have control over. So the main things, really, the positive things, were that money was part of that sense-making dynamic, so it connected residents together and fueled the power within. So this is a quote from one of the partnership members who says, "I realized it weren't about spending the money, it was about doing something together." So they could keep the money in the back pocket. They didn't need to spend it to get the benefits. And it could increase their credibility with other agencies and the influence they could have. So this person here is saying, "I think it's the million gives some level of credibility. You can go to people and say, 'Will you sponsor this? Will you support this?' And they'll go, Yes, because the community has some money to put into the pot. But it's also important to say that the money could be a source of tension. You know, undoubtedly there were some arguments about what the money should be spent on, which groups should get the money, when they should spend the money. Some partnerships were very cautious about spending the money. Others wanted to spend it quite quickly. So it wasn't without its difficulties. But then, you know, I think any group of people, even a family who wins on the lottery, is going to have a lot of tension about who spends the money and how. So just finally, in terms of big local, the impacts on health and well-being are complicated, okay? The things big local residents are spending the money on will have positive impacts on health, both in terms of social support cohesion, but also improved living conditions, without a doubt. Whether that shows at a population level is questionable, really, but it will improve the health of some people. We know that the people who are actively involved, some of them are gaining very significantly in terms of mental health and well-being. Very positive narratives. This is qualitative data about the positive mental health and well-being impacts. Reports of stress were very common. In the interviews we did, in the focus groups, sitting, listening to, observing meetings. But it's really important to recognize that not all stress conditions are health damaging. We know from the research that the combination of a lot of stress and low control is particularly health damaging. And many of these residents had high stress, but they also had high control over the situation. So simply narrating stress didn't mean that it was damaging for health. The other aspects of the stress experience is that we know that it's more damaging if it's chronic rather than episodic. And we're now just looking at the data to see whether there were people who experience stress chronically. At the population level at the moment, there's no evidence of health impacts, but it's that business of the absence of evidence doesn't mean that there's an absence of facts, of impacts. But there were impacts on social determinants, Louise. And for example, it seemed like it was reducing antisocial behavior, which is interesting. So what? So here's my top tips. I'll go through them very quickly. It should only take me a couple of minutes, Louise, if that's all right. On how do we then move to be more socially just in these community initiatives that I think are disproportionately focusing internally rather than externally. And I think that some of those power dynamics in big local were operating to stop those communities from seeing this bigger picture, right? So I've got three or four suggestions. Just very quickly, I'll go through them. The first is that this is a Banksy on the side of a building in London, I think. I think we have to resist lifestyle drift. I think it's still the case that there is too much of a focus on individual behaviors and not a recognition that those individual behaviors are much more appropriately seen as coping mechanisms, living in really difficult circumstances. And if we do manage to stop people from smoking or get on their bike, the chances are that they may not be able to sustain those changes. Or if they do, they might find something else which is equally health damaging. I think we need to design community initiatives to build these capabilities. We need to map power dynamics, and we need to develop strategies to resist those power dynamics. And I won't go through it here, but I think that on that productive power, I think one of the really important things that could be done in these initiatives that is often not done is to have strategies to resist productive power that stigmatizes poor communities. Spatial stigma is a really important issue. And these initiatives, in the 150 big local areas, I think there were only a handful that were really resisting spatial stigma. They didn't all experience it, but not all of those who did were resisting it. And there are resources out there to do power mapping, but if you're going to do asset mapping, then do power mapping first, if you have to do asset mapping. Because I think that the evidence is suggesting that that could be much more positive for the way in which these initiatives impact on the social determinants of health. And then I think we need to take people's experiential knowledge more seriously. This is Grenfell Tower. Some of you may have heard of it. This tower block in one of our wealthiest London suburbs that burnt down because of the cladding on the outside. You may not know that 5 years before, and for the period up to the fire, the residents were writing to the local council telling them about that fire risk. And 3 years before the fire, they got a letter from the local council solicitor to tell them to stop doing it or they would take legal action against them. And then we had the fire with almost 100 people killed and many hundreds traumatized. And then finally, I think we need to reassert the power of advocacy, really, as this Babel calls it, an exemplary equity professional. That, you know, at the moment, advocacy in some areas is seen to be something that you do without your manager seeing you do it, or, you know, that you do it on the side. It's not part of your main job. And I think that Bevan, for example, one of our great orators, who started the NHS, says that advocacy was actually part of being a good quality professional. And I like this notion of an exemplary equity professional. So that's my concluding remarks, really. Enhanced control by communities with little power over decisions which impact on their lives can have direct health benefits, for sure. Too many community initiatives are limiting themselves to what I refer to as the inward gaze of power, neglecting the outward gaze on social transformation and political change. Community approaches must begin by analysing power dynamics and then changing them in the pursuit of social justice, not mapping and activating assets and focusing on behaviour. But, and it's a really important but, no matter how successful we are at working with communities on social transformation, local action won't deliver the change that's needed. That needs to be nationally and internationally. But again, I think there is more opportunity for local communities to connect with national and international movements like the People's Health Movement and the global anti-poverty movements and things. So, you know, building outwards, that external gaze can actually facilitate those kinds of alliances as well. So sorry if I went on a little bit too long, Lois.
Merci beaucoup, Jennie. C'était vraiment un bon tour d'horizon et très certainement, ça pose des questions. Pour continuer un petit peu dans la conversation et continuer à poser des questions, j'invite Yves Bellavance, le coordonnateur de la coalition montréalaise des tables de quartier, à prendre la parole.
Merci, Louise. Et là, c'était très riche comme présentation, Jennie. Je ne sais pas si je vais pouvoir contribuer autant à vos réflexions qui sont quand même très intéressantes. En tout cas, je ne vais certainement pas citer Foucault parce que je ne connais pas Foucault dans le texte, ça c'est sûr. Ce que je pensais faire, en fait, c'est de faire une espèce de caisse de résonance ou d'effet miroir avec ce qui se passe ici pour essayer de répondre à ces enjeux-là à Montréal, comment on a fait pour faire face à ces défis de développement des communautés et à tous les défis de participation citoyenne, de relations de pouvoir et de travail, oui, au niveau local, mais comme vous le dites, effectivement, également avec les autres formes de pouvoir à l'extérieur d'un quartier, à l'extérieur d'un petit territoire. Donc, peut-être rappeler que les tables de quartier, ce sont des structures de concertation qui incarnent l'action collective dans un quartier sur des inégalités sociales et qu'à Montréal, il y a 30 tables de quartier qui rassemblent ou qui tentent de rassembler tout ce qui bouge dans un quartier, c'est-à-dire des institutions, des organismes communautaires, des écoles, le réseau de la santé, mais surtout essayer d'aller capter ce que les citoyens et les citoyennes eux-mêmes veulent pour leur milieu, le développement de leur milieu, améliorer leur qualité de vie et les mettre au cœur de ces démarches-là. Il y a des points d'ancrage un peu à Montréal sur la façon dont on fonctionne que je voulais partager, dans le fond, suite à votre présentation, puis qui sont, je pense, importants pour avoir une espèce de réussite. Le premier point d'ancrage, c'est que le soutien financier aux tables de quartier il s'est développé en travaillant nous-mêmes, donc les gens qui sont sur le terrain, avec 3 bailleurs de fonds à Montréal. Et le niveau de confiance de ces bailleurs de fonds-là dans ces structures d'action intersectorielle était très grand pour réussir à débloquer des fonds pour soutenir leur mandat d'action collective pour améliorer les conditions de vie. Alors, on a la municipalité, on a la ville de Montréal, on a Centraide. Bon, Mario, tout à l'heure, va pouvoir nous parler du côté d'un bailleur de fonds, pourquoi on soutient ce type d'initiative, entre autres, de développement des communautés. Et Centraide, il est là avec l'angle de la pauvreté. Puis, on a aussi la santé publique, donc la direction régionale de la santé publique à Montréal, qui, au fil du temps, a soutenu les tables de quartier dans ce programme-là. Et la santé publique, bien, il y a un déterminant de santé important qui est le pouvoir d'agir des communautés locales pour travailler sur les inégalités sociales de santé. Donc, les vocabulaires ne sont pas les mêmes d'un à l'autre. On parle de pauvreté, on parle de conditions de vie, on parle d'inégalité de santé, déterminant de santé, mais on se retrouve tout le monde ensemble pour avoir une action intéressante sur le terrain qui a un certain impact. Le deuxième, et il y a un cadre de référence qui s'appelle l'Initiative montréalaise de soutien au développement social local. J'ai hâte de voir la traduction, bonne chance. Donc, c'est un long nom qui s'appelle l'Initiative montréalaise et ces 3 bailleurs de fonds-là et nous-mêmes, on est partenaires. Ce n'est pas, ça c'est le deuxième élément intéressant. Donc, on est partenaires, on l'a écrit ensemble, ce cadre-là, qui soutient financièrement ces concertations-là. Donc, les bailleurs de fonds sont en position à la fois de remettre de l'argent, mais d'être partenaires pour améliorer la qualité de vie dans nos quartiers à Montréal. C'est 3 millions de dollars par année. Je ne ferai pas le taux de change en pounds. Vous avez parlé tantôt des pounds, mais c'est 3 millions de dollars par année, 100 000 dollars par table de quartier. Il y a donc 30 tables de quartier à Montréal. Mais cet argent-là, elle sert surtout à consolider ce réseau-là qui rassemble les acteurs du quartier. Ce n'est pas pour développer des projets. Alors, je vais y revenir dans quelques instants, mais c'est pour structurer le quartier, pour avoir un réseau de solidarité et d'intervention. L'autre point d'ancrage, c'est que cette vision-là privilégie l'approche bottom-up. Donc, dans l'identification des enjeux et des actions, plutôt que du top-down. C'est sûr que, et en mettant les citoyens au cœur de ça, c'est sûr que ce n'est pas toujours facile et parfois les bailleurs de fonds qui sont même partenaires et d'autres bailleurs de fonds vont arriver avec des programmes ou des orientations qui peuvent avoir un effet sur des populations et qui aimeraient que les tables de quartier, par exemple, en soient des acteurs importants. Mais l'intérêt, c'est que au lieu de déployer ça, c'est que, comme on se connaît depuis longtemps, on est capable de se parler puis d'essayer de discuter pour mettre en jeu peut-être ces orientations-là, les mettre en jeu dans un quartier plutôt que de les imposer. Un autre point d'ancrage important, c'est la pérennité. Alors, ça fait longtemps, les tables de quartier existent depuis 20, 30, 40 ans à Montréal et l'initiative montréalaise, ce programme qui soutient les tables de quartier depuis 15 ans. Il y a donc là, s'est développé une expertise, un réseau central, un pivot dans un quartier pour rassembler tout le monde, mais surtout une expertise, une connaissance du milieu, des enjeux, des réseaux, des gens qui veulent s'impliquer. C'est un espace de solidarité, vous en avez parlé tantôt, il y a des espaces de solidarité aussi autour de ça, puisqu'une table de quartier doit lire les enjeux qui sont présents, rassembler les gens, mettre au jeu des possibilités d'action et ensuite déterminer d'intervention tout le monde ensemble. Ce n'est pas facile ça non plus, mais c'est ça. Donc, c'est donc un acquis et la pandémie actuelle nous a démontré que c'était un acquis, c'est-à-dire que rapidement, parce qu'il y avait ces structures-là dans les quartiers, en 2 jours, dès le début ici du confinement au mois de mars, ces instances-là se sont tournées de bord, ont travaillé avec la santé publique, avec la Ville de Montréal pour créer des réseaux de solidarité, poursuivre en fait les réseaux de solidarité et les adapter pour donner un soutien aux populations les plus vulnérables dans les quartiers à Montréal. Il y avait donc là un acquis qui était important. Voilà. Ensuite, un autre point d'ancrage, pour moi, c'est l'effet de levier des tables de quartier. Tout à l'heure, je disais qu'il y avait 3 millions de dollars qui arrivaient dans chacune des tables de quartier, puis ça ne finançait pas des projets, pas dans chacune, pardon, évidemment, mais 100 000 dollars dans chacune des tables de quartier. Mais à partir de là, à partir de cette expertise terrain, de ce rôle rassembleur et de la confiance des bailleurs de fonds, ça permet aux tables de quartier d'avoir un effet levier et d'aller chercher d'autres ressources auprès des institutions, auprès des fondations privées, pour être capable de concrétiser des actions qui sont importantes et qui vont avoir un impact sur le cadre de vie ou sur les conditions de vie, dans la mesure, évidemment, où certaines décisions ne relèvent pas des gouvernements qui gèrent centraux qui gèrent les politiques sociales, par exemple, mais à tout le moins d'avoir une action concrète sur le milieu. Dans le fond, c'est une façon de maximiser l'intervention collective avec des choix collectifs qui sont faits par le milieu. C'est une façon de se donner des ressources pour les concrétiser, ces choix-là. Enfin, l'élément dont vous avez parlé aussi, qui est toute la question des rapports de pouvoir, c'est sûr que là, je parle de ce qui se fait à Montréal et on peut avoir une image idyllique et ce n'est pas vrai, ce n'est pas parfait partout. Et la concertation, le fait de rassembler les gens, même dans une structure pérenne comme ça, amène son lot de rapports de force, de rapports de pouvoir entre les acteurs, y compris entre des acteurs communautaires, y compris entre des acteurs publics et des acteurs communautaires aussi. Je pense que toute concertation intersectorielle à ces enjeux-là, ces défis-là par rapport au pouvoir, et on les a aussi. Mais comme je disais tantôt, l'avantage, je pense qu'on a développé quand même certaines... ce cadre-là a permis de développer certaines relations qui nous permettent d'échanger autour de ces questions-là. Par exemple, d'avoir la ville ou un arrondissement de Montréal autour de la table d'une table de quartier ne règle pas la question des interventions d'une table de quartier et d'un milieu sur des politiques publiques de la ville. Donc, on peut être en opposition. Donc, et à ce moment-là, ça pose toute la question de l'équilibre entre ce partenariat-là, le rôle du bailleur de fonds, mais aussi le rôle du milieu qui veut intervenir sur certains enjeux dans un quartier.
Rapidement, pour
oui,
clarifier.
Exactement, c'est là que j'étais rendu, ma chère Louise. Alors, on n'a pas de grande évaluation de tout l'impact de ce que font les tables de quartier à Montréal. Il y a des évaluations par salaire ici et là, si ce n'est des travaux qu'on a fait d'ailleurs avec la CIC sur l'action intersectorielle en milieu urbain à Montréal qui démontraient bien que même des petits gestes étaient porteurs d'impact dans la communauté. Puis je pense que le plus grand impact de ce réseau-là, à Montréal en tout cas, c'est d'avoir créé un réseau de solidarité et un réseau d'échange où des gens se connaissent et où on peut déjà tabler et intervenir sur l'avenir. Voilà.
Merci beaucoup, Yves. Je vais passer la parole à Mario Régis. Mario?
Oui, bien, bonsoir tout le monde. Merci, Mme Popay, pour votre présentation.
Mario, on ne t'entend pas bien.
Baissez le micro, tu vas m'entendre beaucoup mieux comme ça. Et on manquait de pratique, ça fait pas si longtemps qu'on fait des Zooms. Donc, bonsoir tout le monde. Bienvenue. Merci, Mme Popay, pour vos commentaires. Effectivement, très inspirants. On pourrait parler longuement. Je vais essayer de me ramasser. Donc, effectivement, j'aime mieux être présenté comme un partenaire financier que comme un bailleur de fonds. Je trouve que ça ouvre plus de possibilités que juste dire qu'on émet des chèques, qu'on attend des redditions de comptes. Je sais que c'est pas ça qui a été dit, mais j'aime à le dire. Sur la notion de pouvoir, j'aime bien. On est beaucoup dans une approche pas Centraide. Dans notre société, au Québec, au Canada, on est beaucoup dans des approches où on travaille par programme. Donc, les gens sont définis davantage comme étant des bénéficiaires, des usagers, des clients, alors que fondamentalement, ce sont des citoyens qui vivent l'expérience de la pauvreté, de l'exclusion. Et ils ont tout à fait le droit d'exprimer comment ils le vivent, cette expérience-là, et quel est leur point de vue sur les solutions, les causes de leurs problèmes et les solutions. Et ça, c'est un défi, particulièrement quand on est intervenant. Puis j'aime bien, je vais paraphraser, pardon, Mme Popay, c'est particulièrement facile à dire quand on est un homme blanc de la majorité avec une position de pouvoir puis qui vit une expérience de vie quand même assez heureuse, sans trop de grandes difficultés. Donc, c'est important, cette définition commune du problème, parce que la stratégie d'intervention, elle est toujours fonction de comment on définit le problème. C'est vrai pour les personnes qui les vivent, il faut qu'ils fassent partie de la définition du problème, d'où les efforts qui doivent être faits. Et Dieu sait qu'on a appris à travers la COVID qu'on échappait du monde, des communautés plus minoritaires, puis même pas minoritaires. À Montréal, dans certains quartiers, les communautés dites racisées sont majoritaires, puis on les rejoint difficilement, ils ont peu la prise de parole. Mais même entre institutions, la définition du problème, des fois, Yves l'évoquait tout à l'heure, on va parler de pauvreté, d'inégalité, de développement urbain, d'environnement favorable. On parle sensiblement des mêmes choses, mais on ne l'adapte pas toujours de la même façon, d'où l'effort qui est nécessaire et utile dans un cadre comme celui de l'initiative montréalaise pour se comprendre au-delà de nos logiques organisationnelles ou de réseau. Comme partenaire financier, ça nous met des défis, entre autres, ne serait-ce que celle de rendre compte de l'usage des sous qui ont été faits. Puis là, je distingue l'évaluation de la réédition de compte. Et ça m'amène à identifier un certain nombre de paradoxes. J'aurais été curieux d'entendre Mme Popay sur l'expérience là-bas sur certains paradoxes-là. Donc, quand il y a de l'argent disponible dans une communauté, est-ce qu'on doit renforcer d'abord les organismes qui travaillent à la mobilisation ou est-ce qu'on doit soutenir la capacité collective de tous ces organismes-là avec les citoyens de travailler ensemble? Ce sont des arbitrages qui sont extrêmement difficiles à faire. Les tables de quartier le vivent au quotidien. Comme partenaire financier, on est amené à le vivre aussi. Comment on pondère l'effort entre l'effet de la pauvreté ou de l'exclusion versus les causes de la pauvreté et de l'exclusion? Mon expérience, entre autres auprès de la petite enfance, si on veut favoriser un parcours scolaire positif, si on veut permettre aux enfants d'arriver au premier jour de l'école sur la même ligne de départ, il faut se préoccuper de leur développement moteur global, etc. Mais c'est sûr qu'il faut se préoccuper aussi du logement, de la sécurité alimentaire, etc. Mais ça se peut que sur ces enjeux-là, ça prenne un peu plus de temps de voir les effets sur l'enfant. Donc, il faut aussi travailler à la fois sur l'enfant et sur les causes. Tout l'espace d'innovation. Comment on soutient l'espace d'innovation pour pas faire juste plus de ce qu'on fait déjà, mais sortir des sentiers battus, permettre de rêver, permettre d'être audacieux. J'ai l'exemple, par exemple, à Saint-Michel, où dans le cadre du projet Impact collectif, une discussion à un moment donné sur ce qu'on pourrait faire avec la carrière Francon, puis la personne nous a expliqué ça vite comme ça. Et avec le projet Impact collectif, on a pu permettre à des citoyens d'oser le rêver, comment ils le voyaient, ce quartier-là, et ça a donné une proposition vraiment ambitieuse, une proposition intéressante, audacieuse pour Saint-Michel, qui a d'ailleurs fait l'objet d'un reportage dans la presse il y a une dizaine de jours. Vous allez la voir, c'est vraiment génial, c'est une idée qui a été réfléchie par les citoyens. J'ai mon 5 minutes achève, je le sais. Donc, les partenaires financiers, on distingue la réédition de compte, on distingue l'évaluation. Dans l'évaluation, il y a les résultats. Dans le cadre du projet Impact collectif, ce qu'on observe, c'est un rapport de recherche qui vient de sortir, la culture d'évaluation a grandi beaucoup parce qu'on a redonné le pouvoir aux communautés de définir leur propre objet de recherche et de les soutenir dans cette façon de mener la recherche, notamment avec les changements le plus significatifs qui permettent d'aller capter auprès des populations qu'est-ce que ça a donné, qu'est-ce que c'est venu changer dans votre vie, dans votre réalité. Et au-delà de tout ça, ce que la pandémie nous a révélé, puis je pense que Yves va être d'accord, puis en fait, il vient de l'évoquer à ses propres mots, c'est toute la question des actifs intangibles, d'avoir ces réseaux-là dans une communauté où les gens se connaissent bien, puis les gens, oui, mais aussi les organisations se connaissent bien, se sont bien positionnées les unes par rapport aux autres. Quand arrive un événement comme la pandémie, la capacité de réaction, elle est très forte. Cette capacité de trouver des solutions à des problèmes nouveaux, elle est beaucoup plus grande. On l'a vu, c'était inégal d'un quartier à l'autre. De façon générale, c'est exemplaire. Mais c'est ça, plus les communautés, plus qu'à travers les tables de quartier, ces territoires-là, ces partenaires avaient vécu des projets, avaient réussi à mener de l'avant différents projets, de relever différents défis, leur capacité à faire face aux défis, notamment de la pandémie, et à s'est révélée juste plus forte. Et ce n'est pas un luxe dans une société comme Montréal d'avoir des organisations qui ont cette résilience et ces actifs intangibles. Il y aurait plein d'autres choses à dire. Je sais que j'avais mon 5 minutes, je pense que j'y atteins, mais on pourra nous relancer s'il y a des questions.
Merci beaucoup, Mario. Juste parmi les notes que André-Anne a laissées et de ce qu'elle voulait soulever, André-Anne voulait soulever cette idée qu'au Québec, on a longtemps eu une santé publique qui s'attardait aux inégalités sociales, qui d'ailleurs l'initiative montréalaise est le résultat de ce genre d'initiative, mais que depuis une dizaine d'années, la santé publique se recentre vers un inward gaze, et même si en 2017, on a adopté une politique gouvernementale de prévention qui était ambitieuse, qui mettait l'accent sur les milieux de vie, dans les plans d'action, on s'est retranché encore là beaucoup sur les comportements. André-Anne souligne qu'elle a particulièrement apprécié la remise en question du terme « empowerment » dans ses propres travaux sur les interventions de proximité et les réseaux sociaux d'action collective. Tous lui disent faire de l'empowerment, que ce soit pour soutenir l'action des jeunes dans les HLM ou pour développer des mesures de soutien alimentaire aux familles. Sans aucun doute, dit-elle, ces activités dynamisent le milieu, réduisent l'isolement et favorisent globalement diverses formes de soutien social. Ce sont des actions locales qui permettent le développement de compétences individuelles et parfois collectives. Par contre, ces actions favorisent rarement des remises en question des dynamiques de pouvoir qui nous amèneraient à porter un regard vers l'extérieur, vers un outward gaze pour identifier les contraintes à l'exercice du plus grand contrôle collectif. Puis elle termine en demandant au professeur Popay, selon elle, la COVID, est-ce que c'est un champ de mine ou un champ d'opportunité? Yves nous a bien parlé que très rapidement, le milieu a pu se renouveler. Dans le système de santé publique, les organisateurs communautaires font maintenant des appels de suivi et de surveillance plutôt que de faire leur travail au quotidien. Comment, lorsqu'on se réorganisera ou lorsqu'on sortira de nos confinements, tout ça va se redéployer? I will stop here. And I will give it back to you, Jennie, if you want to answer this tour before we open it to the chat. Jennie?
Me. I didn't mute me, somebody muted me. So I would be very interested afterwards in looking to see what has been happening to the inequalities in Montreal and Quebec while you've been doing the local work, because in the UK we have had really bad deterioration in inequalities. So life expectancy for poor women is actually going backwards now. Infant mortality is going up. Suicides are going up. Before the pandemic, this was before the pandemic. The pandemic has disproportionately hit disadvantaged groups, the groups who are most excluded. So I think in theory, a global pandemic is an opportunity to stop and think. And I think Arundhati Roy, I can't remember her words, but she has a very powerful comment about if we go through this door carrying all the baggage, then it will not be different. We have to try and leave the baggage behind. But I can only speak in detail about the UK and England in particular. And I think that the future is going to be really bad. I think inequalities are going to grow. We have this phrase of build back better. There's no evidence that that's even beginning to be done now. So I think that it will vary. You know, it's like the pandemic. The difference in the countries in the way that they've managed pandemic. Fran Baum and a group of us have just written a paper in the BMJ about what is it about those countries that did well in managing the pandemic. There's a pandemic preparedness index that the United Nations have. And before the pandemic, the countries that were most prepared are the countries that have done worse. So America was the most prepared, and of course, and the UK was third or fourth, I can't remember. So what we're saying is actually the future, the ability to take this opportunity of dramatic fracturing of what was happening before depends on where you were socially before. And countries that were more socially cohesive, that had a collective sense of themselves, had better leadership, have managed the pandemic better, and they're almost certainly going to manage the path out of the pandemic better. And Britain is very fractured, very fragmented, after Brexit particularly now as well. So I think our scenario is a bad one. And I do think it's interesting, that analysis, that the countries, you can predict which countries will do better getting out as well from those countries that have done better managing it.
On peut, Patricia, est-ce qu'il y a sur le chat des commentaires?
Pas encore, Louise. Si vous voulez poser vos questions, vous pouvez les écrire dans le chat.
Louise, est-ce que je peux intervenir 2 secondes?
Oui, bien sûr.
Peut-être juste dire que quand moi je dis que les tables de quartier, c'est un acquis et puis qu'elles s'en sont bien tirées et qu'elles ont permis d'être une interface, un acteur important dans les quartiers dans le cadre de la crise pour travailler avec les populations vulnérables. Ça ne veut pas dire que ça a été de la gestion de la crise et ça ne veut pas dire non plus que les problèmes ne sont pas réels comme vous le mentionnez, Jennie. C'est-à-dire qu'on l'a vu, la pandémie a exacerbé les inégalités sociales qui étaient là déjà. Donc, et pour certaines personnes, ça leur a révélé qu'il y avait des inégalités sociales. C'est un peu incroyable, mais c'est ça. Donc, mais il y a encore beaucoup de travail à faire après et on a des craintes pour après. C'est-à-dire qu'il y a comme des communautés à rebâtir après. Là. Il va y avoir des séquelles très graves et effectivement, c'est possible qu'il y ait des mesures d'austérité, par exemple, par la suite. Donc, c'est pas, évidemment, c'est qu'en termes de solidarité, les tables de quartier ont joué leur rôle. Et là, maintenant, je pense que c'est aussi un acquis pour l'avenir, pour être capable d'intervenir pour pas que le pire, avec d'autres acteurs évidemment, là, mais pour pas que le pire arrive dans la suite là, des choses.
Oui, Mario?
Oui, ben là-dessus, je pense que quand on dit les pays les mieux préparés, mais les mieux préparés à quoi? À gérer une crise purement hospitalière ou à gérer tout l'impact social avec tous les leaderships politiques qu'il y avait. Moi, je pense que les communautés, en fait, la pandémie a été une catastrophe, on va s'entendre, quand il y a des temps de mort, quand il y a des familles qui sont divisées, l'isolement, les problèmes de santé mentale, c'est en soi une catastrophe. Maintenant, moi, ce que je constate, Centraide, on a fait notre campagne de financement. La générosité, elle est exemplaire. Et des gens qui au conseil d'administration de Centraide, qui posaient des questions sur « Mais qu'est-ce que ça sert, les tables de quartier? On ne comprend pas trop ce que ça fait. » Là, ils comprennent. Ils comprennent que le fait que des gens travaillent étroitement entre eux a permis une rapidité de réaction à des problèmes qui étaient immenses. Là. Je ne dis pas que tout a super bien été. Là. Dans certains quartiers, ça allait vraiment pas bien. Puis les gens des tables de quartier ont dû travailler très, très fort pour endiguer le plus possible tout ce qui se passait. Là. Je pense notamment à Montréal-Nord qui a fait les manchettes, mais il y a eu plein d'autres quartiers. Donc, à partir de ce moment-ci, la question, c'est comment on va rebondir comme société. Il faut se rappeler que la société québécoise a été quand même assez exemplaire sur la réduction des inégalités dans un contexte nord-américain, on s'entend, puis que dans les dernières années, il y a eu une certaine dérive, puis un certain laisser-aller. C'est les politiques sociales qui vont faire qu'on va être capable d'endiguer les inégalités. Ce n'est pas juste les tables de quartier, il ne faut pas mettre le poids là-dessus. Maintenant, comment on reconstruit les tissus? Et là, là où je pense qu'on a un défi immense, c'est que les communautés territoriales, Mme Popay l'a nommé au départ, on a abordé la discussion sur les communautés territoriales. Mais il y a présentement dans nos communautés d'autres superpositions. Il y a des notamment à cause pas à cause ou grâce à Internet, il y a maintenant des communautés culturelles, il y a des communautés religieuses, il y a des communautés d'intérêt qui dépassent les frontières d'un territoire. Et là, pour moi, ça pose un certain défi de comment recréer une cohérence de toutes ces communautés-là. Il ne s'agit pas d'interdire les gens là, d'avoir des affinités d'intérêt avec je pense entre autres à des sites de jeunes parents à travers tout le Québec, puis même en dehors, ça va continuer, puis c'est correct. Mais comment on recrée une cohérence, une cohésion dans nos communautés territoriales quand les gens peuvent avoir un sentiment d'appartenance beaucoup plus fort à des communautés d'un autre ordre, par exemple, communautés culturelles, religieuses, linguistiques, même sexuelles au niveau de la communauté LGBT+, etc. Là, pour moi, il y a comme un petit défi là,
Jennie?
So I wanted to respond to that point Mario was making and Yves a little. I think what you're doing, what I hear is a very good example of the problem with the inward gaze, while the outward gaze is marginalized. So you have got very strong local networks. And in fact, in England, those areas with very strong big locals had exactly that experience, that they responded to the pandemic instantly and they were out there and they were very, very effective. But meanwhile, inequalities have been widening, right? So that's why this network of tables, and in the UK, this network, we need to look outward more at social transformation. What collectively can those tables do out there, right? Rather than in the neighborhoods. And that's the point I'm trying to make with the focus, the inward gaze being important, but too dominant at the moment. So that we are neglecting the outward gaze, which was the one about solidarity changing the political dynamics. Yes. So then that's a very challenging. And I think that when in the places where that began to happen, it was shut down very quickly so in Brazil, they had a period of 10 years. In the UK in the 60s and 70s, we did, when community organizations were focused outward. They were building alliances across the country, also internationally through the labor movement. And they got their funding cut very quickly because they were no longer focusing local, they were focusing national and global. So I think that's a very good example, Mario, of what I was trying to explain. I'm not saying that this inward gaze at the local is not a good thing. I'm saying it's not sufficient, because at the time that Montreal and Quebec have been making progress with the tables, you've also seen increasing inequality. You've also seen austerity, so the cuts to public expenditure, which we've had as well. That's all been going on while you've had this enormously powerful, rich, local stuff going on. And that's my point. That is my point.
And point well taken. Merci beaucoup, Mario. Merci beaucoup, Yves. Merci beaucoup, Jennie. Merci à tout le monde qui était là, qui a pris le temps de nous écouter. Restez avec nous. Nous serons présents, nous, le CReSP, nous serons présents dans vos vies pour vous donner comme ça une nourriture intellectuelle et échanger avec vous autant que possible. Merci.